Welcome to our channel. Today we're diving into an important topic, understanding life with STDs and breaking down each one. We're going to cover the basics, what to look out for, and how to handle things if you or someone you know is diagnosed. Listen, I know talking about STDs can be a little uncomfortable, but it's crucial to be informed. We're all adults here, and knowledge is power, right? The more you know, the better equipped you are to protect yourself and your partners, so let's ditch the stigma, have an open and honest conversation, and learn together. Living with an STD can be a very different experience for different people. For some, it might be a minor inconvenience, easily managed with medication, but for others it can have a significant impact on their physical, emotional and social well-being. First and foremost, let's acknowledge the elephant in the room, the stigma. Unfortunately, there's still a lot of shame and judgment surrounding STDs, which can make it difficult for people to open up, seek help, or even disclose their status to partners. This fear of judgment can be incredibly isolating. Beyond the emotional toll, there's also the physical aspect. Some STDs, if left untreated, can lead to serious long-term health problems. We're talking about things like infertility, certain types of cancer, and even an increased risk of HIV transmission. And then there's the impact on relationships. Disclosing your status to a partner can be a nerve-wracking experience. It requires honesty, vulnerability, and open communication. It's important to remember that everyone reacts differently to this kind of news. Now, I don't say this to scare you, but to emphasize the importance of education, prevention, and early detection. Knowing your status is crucial, and regular testing should be a part of everyone's healthcare routine. Remember, getting diagnosed with an STD is not the end of the world. With the right information, support, and treatment, you can absolutely live a long, healthy, and fulfilling life. Let's talk about herpes, specifically herpes simplex virus, HSV. Now, there are two main types, HSV1, which typically causes oral herpes, cold sores, and HSV2, which is usually associated with genital herpes. Here's the thing, herpes is incredibly common. In fact, a majority of people have at least one type. And the thing is, many people don't even know they have it because they never experience symptoms, or their symptoms are so mild they don't think anything of it. When symptoms do occur, they usually involve painful blisters or sores around the mouth, genitals or rectum. You might also experience flu-like symptoms like fever, body aches or swollen lymph nodes. The first outbreak is usually the worst, with subsequent outbreaks tending to be milder and shorter. Now, the bad news is that there's no cure for herpes. But the good news is that there are antiviral medications that can help manage outbreaks, reduce their severity and frequency, and lower the risk of transmission. Living with herpes is manageable, but it does require some adjustments. It's important to be mindful of your outbreaks, practice safe sex by using condoms and informing your partners, and take your medication as prescribed. Remember, having herpes doesn't make you any less worthy of love, intimacy, or a fulfilling life. Don't let the stigma hold you back from living your life to the fullest. HIV, which stands for human immunodeficiency virus, is a virus that attacks the body's immune system, making it harder to fight off infections. If left untreated, HIV can progress to AIDS, which stands for acquired immunodeficiency syndrome, the most advanced stage of HIV infection. Now let's clear up some misconceptions. HIV is not a death sentence. With early diagnosis and proper treatment, people with HIV can live long and healthy lives. In fact, many people living with HIV have undetectable viral loads, meaning they cannot transmit the virus to others. HIV is primarily transmitted through bodily fluids like blood, semen, vaginal fluids, and breast milk. It can be spread through unprotected sex, sharing needles, or from mother to child during pregnancy, childbirth, or breastfeeding. Symptoms of HIV can vary greatly, but some common ones include fever, fatigue, swollen lymph nodes, skin rashes, and unexplained weight loss. However, the only way to know for sure if you have HIV is to get tested. Treatment for HIV typically involves antiretroviral therapy, or ART, a combination of medications that work to suppress the virus and prevent it from damaging the immune system. ART is incredibly effective in managing HIV and preventing progression to AIDS. Living with HIV can come with its challenges, from managing medication side effects to navigating the social stigma that still surrounds the virus. But remember, you are not alone. There are incredible resources and support systems available to help you live a full and healthy life with HIV. HPV, or human papillomavirus, is a group of viruses that are incredibly common. In fact, most people will contract at least one type of HPV in their lifetime. There are many different types of HPV, some low risk and some high risk. Low-risk HPV types can cause warts, while high-risk types can lead to certain types of cancer, including cervical, anal, throat, penile, and vaginal cancer. However, it's important to note that not everyone who contracts high-risk HPV will develop cancer. Most HPV infections clear up on their own without causing any health problems. But when HPV persists, it can cause changes in the cells, which over time can lead to cancer. There's no cure for HPV, but there is a vaccine that can protect against the most common cancer-causing types. The HPV vaccine is incredibly safe and effective, and it's recommended for all adolescents, both boys and girls, ideally before they become sexually active. Regular screenings like Pap tests for women can help detect any abnormal cell changes in the cervix caused by HPV and allow for early intervention. Living with HPV might not even be something you're aware of, as many people never experience symptoms. But if you do have any concerns, talk to your doctor about getting tested and discuss whether the HPV vaccine is right for you. Chlamydia is a common sexually transmitted infection caused by bacteria. It's often called the silent infection because most people with chlamydia don't experience any symptoms. This can be problematic because if left untreated, chlamydia can lead to serious health problems, particularly for women. In women, untreated chlamydia can cause pelvic inflammatory disease, or PID, which can lead to chronic pelvic pain, infertility, and ectopic pregnancy. In men, it can cause epididymitis, an inflammation of the tube that carries sperm from the testicles, leading to pain and, in rare cases, infertility. When symptoms do occur, they can include pain during urination, unusual discharge from the vagina or penis, pain during sex, and testicular pain or swelling. The good news is that chlamydia is easily treatable with antibiotics. It's crucial to complete the entire course of antibiotics as prescribed, even if your symptoms clear up before you finish the medication. Because chlamydia is often asymptomatic, regular testing is crucial, especially for sexually active individuals. Early detection and treatment are key to preventing long-term health complications. Remember, there's no shame in getting tested for STDs. It's a responsible part of taking care of your sexual health. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and share it with others who might benefit. Remember, knowledge is power when it comes to STDs. Knowing your status is crucial, and regular testing should be a part of everyone's healthcare routine. If you have any concerns or questions, don't hesitate to reach out to your doctor or a trusted healthcare professional. Stay informed and stay healthy.